oh yeah, we dropped that case for this reason. There's no testing. There's nothing that can be done. Like there has to be something here.
Hey, Dr. Chris here with the Health Heroes podcast. And today we have a special attorney. We have Kaitlin from Nares Law Group.
Nice to be here. Thank
And
you.
thanks for being on the show. I actually met you when you were at the CCA,
Yes.
the Chiropractic Convention, and talked to you a bit there. And one of the reasons we want to have you on your show is because you're a personal injury attorney, which fits totally in with anyone that we would consider a health hero. But you also have a niche and you do some specialty stuff.
Yes.
So first, I'm curious. When you're going through, like, why did you go into law school, and then what came about with that really drew your focus to personal injury?
So I kind of always wanted to go to med school. It was always the path I wanted to take. Ultimately, I kind of diverted into law, but I knew from the outset, like something highly focused in medical was what I wanted to do.
Mm-hmm.
And when I first got out of law school, I had a once in a lifetime opportunity to work on the largest civil rights case in history, which was the Central Park Five case, and really just got to learn how to hyper focus on one type of case
Mm-hmm.
and really just get in there and understand everything about it. Now, that case didn't include any kind of personal injury or medical, but what it did was just it took years of just assessing data, improving our case, improving liability, and everything about it. And it was a great training ground to really decide how do you advocate at like the highest possible level. And it ended up being the largest civil rights settlement in history and gave me an opportunity to leave Manhattan and start the Corey Wise CU Boulder Innocence Project here in Colorado. Really random to come to Colorado. And when I got here, it was the start of, my desire to start a law firm. And that was going to really focus on like peak of advocacy. And I really truly believe that you can't specialize in everything.
It's
And,
true.
doctors hyper focus on what they do, even down to sometimes the body part.
Mm-hmm.
But in law, we are so generalist, right? You have a family law attorney, you have a bankruptcy attorney, a corporate attorney,
Mm-hmm.
personal injury attorney. And I knew that I wanted to be hyper focused and only do one thing and master it. And so I really started doing brain injury cases and have been doing it for many years now. And it's just specifically what I focus on and target. And 100% of my clients have a brain injury. They have ortho injuries as well, of course, but it's really unique to have a law firm where everyone has the same thing. And you can see those patterns emerging amongst all of them.
You know what's interesting about that is my background as a chiropractor. I do something called chiropractic biophysics, which is a bit of a specialty already in structural correction.
Hmm.
But then I started doing scoliosis work. And at one point, someone said, "Hey, you should maybe just do scoliosis." I'm like,
Yeah.
I was like, "Oh, it's so hard," and I kind of put it off for a while. But then I got a point where I didn't see any patients accept that, and it got easier. But then I started seeing this all kinds of stuff coming to me.
Yeah.
But then when I focused just on that, like that's all I do now. Some of my friends are like, how do you stay busy just doing scoliosis? I'm like, because people come from all over the U.S. and world because you just get better and better and better
Yeah.
at solving this problem that most people don't really understand or know what to do about it. And it almost is more work involved to get to expertise.
Hmm.
But then in some aspects, I found it gets easier because you find people that are like searching for someone that has that skill set a lot.
100%. And it's like an incredible amount of work to not only build up your knowledge base, but also put out to the world your specialty skill. But then it's like a watershed moment where you're like, this is what I do. So now I just have this vast amount of similar clientele where I can see patterns.
Yep.
Things are getting easier. Before we were just kind of talking about my cases and my clients,
Mm-hmm.
and I was seeing these patterns that were emerging where all my female clients have lost their period, all my male clients have had ED, and then it started me looking into how brain injuries impact the reproductive system. I have a clear pattern across multiple people. And so it comes to a point when you're hyper focused, you start seeing these things and it becomes easier and easier to predict what's happening and to
Yep.
advocate for people.
Do you find that sometimes the more like in depth your knowledge base gets, things that become just very straightforward to you, you forget doing with the other colleagues that, oh, that is not straightforward to you, or what seems
Yeah.
very simple to you, they maybe never even looked at or heard of. Do you start ever seeing that?
Yes, so that came about. I was giving a presentation and I caught myself that I was talking about all these objective tests that are done to show objectively brain injury. It's not invisible injury, it's actually objective as can be. We have clear tests that match clear symptoms. And I was talking about the tests and using, um, video nystagmography. I was calling it a VNG and stuff like that, and just like seeing just the clueless look on other personal injury attorneys' faces. Um, it's a unique niche to be in where I have the vernacular now of a neurologist
Hmm.
and can speak to them very freely about it, but I have to realize that not a lot of people know this. Now, that was another watershed moment where you get so high up in your skill set, you realize, okay, I have to take everything I have and I have to learn how to talk about this
Hmm.
to an 8-year-old. Because ultimately, our goal is not only educate the public, but to be able to get a jury to understand
Yep.
what is going on. So that was really helpful. And that really started a movement we were making in the past couple months to just educate personal injury attorneys about this and to understand how to do these cases. And it really helped us kind of distill complicated information to really easy to understand
Don't you think
vernacular.
that though is also where your level of understanding something goes to the highest level when you have to be able to teach others? Like it's one thing to understand it and get it in your brain, something complex, but to go, oh, how do I take this and distill it down so I can get anyone to understand it? That takes
Mhm.
another that enhances your own learning, I think.
100%. And I love analogies and I love, for instance, the way information is processed in the body, it's in a neuron, and a neuron is basically like a car that sources information and it drives down a highway, and the highway is basically a fiber track. And so it's
Hmm.
just trying to come up with those analogies to talk about really the complex issue of neurology and what's going on with the brain. But using analogies, having demonstratives is really great. I have a garden hose that I'll use at
Hmm.
trial to talk about the fiber tracks. And so really just trying to understand the basics. As you can see, my office is behind me and all the little, I
Yeah.
have the spine and the brain and everything over there that we utilize.
Well, okay, so for our audience that doesn't know you, you have attorneys, then you have attorneys that specialize in personal injury. A lot of those involve people that are injured in car crashes. But then within that, you have a specialty in like brain trauma and
Yeah.
stuff like that. So how did you ever get one into like brain injury? And then also, what is that like? Because I think maybe the general public don't think about this. You go to school to learn to be a lawyer, but now you have to learn like a lot with whatever you're gonna a specialty in.
Yeah.
So like, how did that go? Like, how did you start to learn and like, what is that? It's like going to school again,
Yeah.
basically.
Oh, 100%. I mean, I law school basically teaches you to think
How to win an argument.
rationally without emotion, and to be able to come up with an argument on either side, basically debate team. That's
Hmm.
really all you're going to get. Then you come out of law school and you decide you're going to focus in one generalized area. So we talked about commercial or business law. We talked about bankruptcy, family law, criminal law, just very broad. And there's so much in those different spheres. So, personal injury is basically advocating for someone that was injured at no fault of their own by various means. I was injured by this crack in the sidewalk. I was injured by someone
Hmm.
poisoning me, like a toxic tour case. I was injured by a car wreck. Someone other than me injured me, and that could be so many different types of cases. And so it's a broad range. And then what I do is I hyper niche on the injury itself. So I focus on the brain injury and it comes whatever way it comes. So I never thought that I had to master carbon monoxide cases, but I had a woman that was brain injured by being poisoned from the furnace system at her very poshy Westminster condo. And she sustained catastrophic brain injury. And I never thought I had to master how to do carbon monoxide cases, but I had to. So I'm constantly learning based on the case that comes my way. I have traumatic daycare cases where a child sustains um, really severe brain damage at the fall of a nanny or daycare, and learning about that system and the oversight about daycare systems
Mm.
and the licensure. So I'm constantly learning. All of it's uniquely brain injury cases, but the mechanism of harm is different every little call I get. So it's always learning differently. First, if I was to say I do motor vehicle cases, and all I do is people that are rear-ended by a vehicle, and
Hmm.
those can come in different types of injuries, but it's the same case every single time, pretty much. Whereas ours are just so different.
So even within a specialty, there's such a niche specialty, which is just like being a doctor. Like, oh, I'm gonna
Yeah,
go be a doctor. What kind of doctor? Well, I want to be a chiropractor. Great. Well, within chiropractic, there's so many substitutes. Like,
yeah,
well, I want to work in personal injury. Well, within personal injury, there could be people that have very unique
yeah,
skill sets too. And patients understand that because if they especially if you ever know someone that's had like a condition that's kind of rare or not common,
yeah.
that's when you start going down these paths and you're looking for the guy or the woman,
Hmm.
like the person like that has the answer or may have the answer.
Yeah.
And it's not the generalist. And a lot of times you may have to go to someone and someone's like, oh, this is the person.
Yeah,
So
100%. So just hyper niching, and again, it's we never know, and we have to become masters in how they sustain the brain injury. And I bring up the carbon monoxide case because that was one where she had called 5 lawyers, couldn't get anybody to take on the case. They thought, "Oh, you should get some back rent from landlord tenant or something." She ultimately was only able to get a Texas law firm to take it on. They brought us in because it was a Colorado case, and we were able to get multi millions for her. It was a very, very large brain injury case, but no one saw it that way. They saw it as a landlord tenant case. And in fact, the defense hired the landlord tenant attorneys. Little did they know who they were getting on the other side. But it's really just when you really, really want to do these types of cases and do them well, like you'll figure out a way to do it.
hmm okay, so imagine for our audience, talk about the importance and how you go about finding a specific type of attorney. And, because I've had some friends that were in crashes and I said, hey, great, did you have an attorney? They said, oh, yeah, I have a friend that's a lawyer. And they said they could help me. I'm like, great. Are they a personal injury attorney? No, they're like an attorney, but they said they could do it. So I just cringe right away.
Yeah.
So now, for a patient potentially watching someone injured in a crash, you have something happen. How should someone go about, like, first of all, why is it important to find someone that specializes in a certain area,
Yeah.
and how can they start going about looking for someone that may be a best fit for them, or what's the right type of attorney like for me?
Yeah. I think people, unfortunately, marketing strays people in the wrong way because you're not necessarily looking for results, right?
Hmm.
Because a lot of the case for someone that's injured is the treatment, making sure that they're seeing the correct doctors, the right doctors for
Hmm.
them, that they're being cared for and have the guidance. So having advertising about this is the results we get maybe doesn't talk about the customer service experience that they're going to have. And so, really, what you want to do first and foremost is when you're talking to a lawyer, is focus on 2 things. One, you're going to tell them what outcome you want, and ultimately, what you're looking for is a more hopeful future. I need guidance. I need support. I have no idea what to do. I want to get to a more hopeful place than I am now. So, really keen in what is deserving of people is the customer service experience. And we practice something that we call unreasonable hospitality, which was a book that was
I
written.
just we just read it in our office as a team.
We
Yeah.
absolutely love it, and so that is what is needed, is unreasonable hospitality, and that is what someone should deservingly get when they go to a law firm. They need to be guided through the treatment process and make sure everything is cared for. That is just as important as the lawyer's skill set to get a very deserving outcome.
Hmm.
You need both, and I think the hospitality and the guidance and the care and the way we communicate and the support we give, that is completely overlooked by most law firms. So we believe in something that's called value beyond limits, and what that means is limits as in policy limits,
Hmm.
your insurance carrier policy limits. That is never a barrier for us. We will always provide value for you for the long term. Clearly, you feel the same thing because you're trying to give information resources to the people that you
Hmm.
help. And it's just how can we give endless resources, endless support to someone past their case? Um, because I hate to break it to you, when you get a settlement check, your brain injury doesn't get cured.
Yep.
You're the same person the next day. Most people don't want their case to end. So, another pattern I saw, we would resolve a case and the client didn't want to pick up the check, and we would be like, what is going on? No one wants to come to pick up their check, or no one like is calling us back about it. And we really like started asking our clients what's going on. They were like, we don't want it because that means we don't get the support anymore. And I was like, oh my gosh, that's what people think. And they really continued to need the guidance and support. And so we realized we need to continue that on for the
Hmm.
long term. So that's what we call value beyond limits. It's that unreasonable hospitality of like, how can we create a brain injury survivor community and keep giving resources to them?
So what are some of the things you've done, and what are some of the resources that you're able to provide your clients?
So it's really thinking through the experience of what someone has to go to. So it's like attorneys work so hard to advocate at trial or to adjuster about your future care needs, but they don't really like live it out. Like if I'm articulating someone with a brain injury, imagine their life and how it spirals and how their relationships crumble and how they're likely going to get a divorce and how they may become suicidal and how they need constant resources. They can't keep a job. They're now have financial instability. They're fighting with people. They lose their friendships. We can go on for days about how it impacts their life, and I can articulate for that and get you a good settlement, but I
Mm.
don't care that it's actually going to happen. So some of those things is like I just listed, like making sure that they get into like couples counseling, making sure that they
Mhm.
learn resources about how they can maintain friendships, getting FMLA disability like resources, um, housing stability resources, setting them up for food delivery and home cleaning, like job workforce training. It's like you have to live out what you just advocated for, and so that's what we try to keep educating them on kind of month in, month
Mhm.
out. Having physicians like you talk about, like, you're going to need continued health and maintenance, like over time. This is some skills you can do, some resources you could do, providers you should see. So that's really what we're trying to give as time goes on.
So for a patient watching this, they may not even know if they have a brain injury. And I see that all the time. Somebody's like, "Oh, I didn't have a concussion. I don't remember losing consciousness."
Yeah.
Well, first of all, you wouldn't.
Yeah.
But a lot of times things are missed. So what are some of the signs or symptoms that someone should be aware of that could indicate they have a brain injury
Yeah.
after some kind of trauma?
The biggest thing we see is that people are primed to think they don't have a brain injury by the people in their lives. So what happens is, on scene, you um, obviously can have a brain injury not by hitting your head. That is the shaking in the skull. So I always
Yep.
say, get a mason jar, put
Tomato in there,
some
shake
it
it,
and
something
shake
like
it.
that.
That's really, it's called coup contre coup.
Yep.
It's your brain knocking against the skull. So just because you didn't hit something, even that injury can cause a diffuse injury. What happens is you have your primary injury. So you're like dizzy, disoriented, you don't really know what happened, you're kind of in shock, you're exchanging information, you're kind of
Hmm.
processing what's going on. That's your initial injury. Well, during that time, your brain is going haywire. There is like a chemical cascade of what's going on, decreased oxygen, decreased blood flow. And it takes about 2 weeks for you to get that secondary injury.
Hmm.
And that secondary injury is like the slew of what we see, which is dizziness, disorientation, vertigo, brain fog, everything across the board. And there's that like gap of quiet. And it's
Hmm.
that gap of quiet is where you're starting to get primed by people around you. Nothing's going on. So that time you probably went to an urgent care or an ER, and maybe they did a CT or MRI and they didn't see anything. Why would they? Because even a dead person has like a normal
Hmm.
brain MRI. Because unless you have a skull fracture, it's going to be a normal brain MRI. So you're probably told by EMS, ER, primary care, your people around you, like, you look fine.
Yep, you're fine. Go
You're
home.
just so primed at this point, like, I'm fine, I'm fine, I'm fine. And then around the 2 week marker, and that's why high school kids go on a 2 week concussion protocol, around the 2 week marker, you're like really hitting hard and you're like doubting yourself at this point because you were told you were fine.
Hmm.
And so that's what we're seeing consistently, another pattern of what happened. Um, and we're also seeing other things that make you also think you're crazy, because a lot of my clients have a fever immediately upon a brain injury, or they have heart palpitations or respiratory issues, or they can't like maintain their body and they're like, I'm just going crazy here. I think I'm having a heart attack. I think I have the flu. It's just all in my
Hmm.
brain. It is all in your brain. Like
Yeah.
literally, you're now getting the secondary symptoms. But they're so primed by people around you. Like, you look fine. You look fine. So that's what we're initially noticing. Just be really attuned to the symptoms you have. And
Hmm.
that's, it's so normal in high school sports to go on a 2 week concussion protocol. Like, you got to put yourself in the same thing. What
Yep.
did I have? What am I experiencing? We find that we are kind of the first to identify it, unfortunately.
Yeah. And then you mentioned some of the things that impact life related to like emotion, emotional stability, and like relationships.
Yeah.
Why does that happen? And then like how, when you look at a personal injury case beyond just like physical pain, how does that get considered in law? Because I think a lot of patients don't realize that's part of
Yeah.
how everything's looked at.
Yeah. So the kind of the relation part, I always want to say, like, what caused this? And then it makes it so clear why people are so irritable and different. And so we have all this information we're processing from the five senses, right? Like, you're
Hmm.
talking to me, but like dog can be barking, something can be chirping, like everything's going on, I'm processing it. Um, Someone with a brain injury, they're going to process the same amount of info
Hmm.
from the five senses, but their ability to get that info to where it needs to go is now limited.
Hmm.
And it's so frustrating because I still need to process what's happening, but I can't get the info where it needs to go. Therefore, I'm having memory issues, or I'm word finding issues. I don't know how to say it. I'm brain fogged. And for that frustrating reason, that's where you're seeing all the emotional, like, I can't say what I want to say, but I want to say it.
Yep.
And I'm just angry. And that's really where we're seeing like the emotional kind of trauma that goes about that. And I think educating my clients on what's causing it helps them to understand.
Yeah.
That's where it comes with coping mechanisms. How can you learn to cope? How can you learn to put the sticky notes where you need to do? Take
Hmm.
a break. All of those kind of things kind of come from that.
Interesting.
Yeah.
I'm curious. Do you have a favorite, or can you talk about one of your favorite stories of someone you represented and that you just know the work you did made a big impact on their overall life?
Oh, 100%. So one case, I always remember I said I do the injury. We don't know the mechanism of harm. So one of them was a baby that was overseen by a in-home nanny, and she left the baby on the bed and she went downstairs to get a bottle. And the baby rolled off. He was 11 months old. He rolled off and sustained catastrophic multi-surgery brain injury.
Just from going from a bed to the floor.
Bed to the floor. He just fell in just the way that just created catastrophic damage. This was a unique case where we had an unlicensed nanny situation. There was really no real source of recovery. We were ultimately able to get something done there. Right, we were able to get something personally from the nanny. But what came about from that case particularly was like advocacy change, and it was the first time where we saw that this is a community, that the mom was so appreciative of the work we did. And what we're trying to do is change the laws in Colorado where I can't get someone to clean my window without them being bonded and insured.
Hmm.
But somehow we can have unlicensed nanny shares, no coverage whatsoever for any of this. And so we're going to try to change the law where we are requiring that anybody that is in nanny services whatsoever have to have some kind of commercial coverage.
Do some have it now?
Very few, if at all, right? So you have two types of daycare cases. You have an established daycare facility with a commercial
Hmm.
policy, or you have these nanny shares that are so prevalent in Denver, where you just have a nanny and they'll take care of maybe like three or four kids at a time,
Hmm.
no coverage whatsoever for that
Yeah.
to protect. And I can't tell you how many catastrophic cases have come our way. And really, what we're noticing is what will have to happen is the law to change.
In those kind of situations, you mentioned like daycares, because I know there's a whole area of at home or at senior care too. It's a
Hmm.
big thing that's growing. How many of those do you think is where there was some kind of accident versus someone like caused some physical injury or something like that?
Yeah. So I think a lot of the time it's not so much like nefarious acts, but I think it's just it's negligent hiring, negligent training, negligent retention, negligent supervision. And that's what we're seeing kind of across the board, from truck wreck cases to, in a carbon monoxide case, it was the management company not overseeing the HVAC company. And so it's just like recurringly, we're just seeing negligent hiring, training, supervision is like the main cause of so many things. When that happens, like, harm is preventable. Uh, We were
Hmm.
negligent in our training. We were negligent in the policies we maintained. We were negligent in supervising what would happen. And when it's foreseeable, it's 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 so bad. It's so harmful because it likely never would have happened.
And so I guess, I mean, do you have an ideal client persona, or like what's the like perfect type of client for you, or if someone's watching this, if you were speaking to the perfect kind of person you like to represent, or your law firm does, like who is that?
Yeah. So we tend to I mean, we really obviously it's a brain injury case, but people that are watching this may be like, "Oh my gosh, you're a brain injury lawyer. It must be very catastrophic." It's not. It's sometimes just those milder symptoms, the headaches, uh, brain fog, those types of things. Those are all symptoms of that harm I talked about, which was these fiber tracts where your neurons are flowing through damage. We are able to help those cases. Why is that so important? Those cases are in a black hole where other personal injury law firms don't know what to do and they don't want to represent these people because they don't know how to help or support them. And they drop these cases. The law firm, like, literally will send a rejection letter, and I've seen it. It just says, unfortunately, all you have is a concussion. Therefore, we feel like we can't help you. We are terminating representation. And those cases can be debilitating for someone. Um, Imagine in your day not being able to focus on the computer. Imagine in your day having like a little buzzing tinnitus sound in your ear. Like, imagine all these things that are, it's not catastrophic, but it just like eats away at you as a human. And there is a cause to these things. And the cause is that you still have permanent injury to your brain.
Hmm.
And so we really like working on those particular types of cases and in child cases. Child cases we love working on because people treat it the same way. It's a child. There's not a lot of objective testing that can be done. We don't really know how we're going to be able to prove their future. So it's not a case that we want to take on, right? That's what we hear all the time. But we love working on those cases. We love bringing in teachers. We love talking about the nuanced differences. A good example of this is we had a child, he was hit by a car and he was flown 8 feet. He miraculously didn't sustain any orthopedic injury, just some bruising, but a brain injury. And the law firm that had that case dropped it. No orthopedic injuries. Like, we don't know how to do this case. This was a 5-year-old, fully potty trained. He has now regressed and he wets the bed every night. Um, he has outbursts because he's so frustrated. He's nauseous, so he doesn't eat. So he's hungry. So that's why he's having these outbursts. He's not saying he's nauseous, but we're noticing like a lack of it.
Hmm.
So we like just hyper watched his regression in his behavior, and we're able to prove up this case that others thought we couldn't.
What are some of the challenges you have dealing with an infant or a child, like just in communication
Yeah.
to understand what's going on? Like, what are some of the challenges there are
Yeah.
with that? And then what are some of the solutions you have to kind of do that?
I think it's the same thing maybe you're looking at when you have even a child for chiropractic care, which is they're nonverbal. And so what we're really going to look at, you may be looking at their gait or how they're standing or their
Hmm.
regression, right? This child was walking and now they're back to crawling. So we're looking at the same thing. How are they regressing? And we're trying to find the cause of the behavior. So he was having these outbursts and we were trying to figure it out, but he was having outbursts because he was starving, because he wasn't eating, because he was nauseous, because he was
Hmm.
having dizziness, disorientation, vertigo. But he can't tell me that.
Yep.
And so we just really were tracking kind of the regressions and the behaviors that they were having. And that comes a lot with talking to teachers and talking to the parents and really hyper focusing on, you know, what the actions are versus having them articulated
Probably
to
a lot
us.
of observation,
Yeah.
just noticing subtleties and stuff like that.
Yeah. And what's difficult admittedly about those cases is the brain isn't fully formed. So I even told you for an adult, so much happens between the initial injury and the secondary symptoms you see over 2 weeks, like chemical cascades, lack of blood flow, lack of oxygen, inflammation, lots of stuff is going on. So for these kids, their brain isn't even fully formed yet. So there's so much going on, and we're not even going to really see the outcome of this until there's 18. Now, here's the pressure adjuster. You can have this case open for the next 18 years if you want, or I can articulate to you what's going on now. And so it's really just educating the adjuster about how we're not going to know the full harm and scope of this case for the next 18 years. And you can keep your file open that long, or I can start to educate you what's happening.
How much more did you learn just
Mm.
about kids and development as you started getting into this area? Because I have my own
Yeah.
I have my own story about some of my first pediatric cases. So I'm curious for you, the first time you started seeing some of these child cases, like, did your knowledge base or awareness in just kids and how they develop and all that, did that grow or expand?
It 100% did, because I knew there wasn't a lot of objective testing they could get. And so I remember I was saying, like, people think brain injuries are invisible injuries. No, they were the most objective injuries we can get. They're
Hmm.
clear tests for clear symptoms. But I can't do those tests on kids. And so it was just diving in and understanding regression patterns and how you can regress, and just really diving into it. And the first case we had was that unfortunate case of William, who fell off the bed and sustained the traumatic brain injury. And it was just kind of understanding how he was regressing and all the things that were happening. And then we started seeing a pattern with all the kids that we had.
Yeah.
Typically, you'll go from being potty trained to not. You will go, and if you were newly learning how to walk, you will go back to crawling, and you see all the regression patterns.
Yeah, the reason I asked is I remember the first time I had an infant scoliosis case. It was a kid
Mm,
with muscular dystrophy,
mm,
and the mom brought him in, and I was talking to this guy. He's one of the top experts internationally in dealing with his cases, and just kind of goes, "Hey, it's my first one like this, and just things to be aware of. And we know the underlying pathology, and what should I do?" And he's like, "Well, big thing go through," and he's like, look at all of the developmental signs and check where he is developmentally for his age and all that. And he goes, "Any questions?" I go, "Yeah." I go, "I've never been around little kids.
Yep.
How do I know where they're supposed to be?" And but
Exactly.
now I deal. That's why I do that a ton, so I know like all the stages of development and where they grow. But I remember the first time I was like, yeah, I've never had kids, and so I'm like looking about.
Yeah, exactly.
That's why I was curious.
Yes, the funny story about my law firm was I had an 8-month-old when I started the law firm, and the day I launched, I felt real nauseous. Thought I was nervous. Found out I was pregnant with my second. So people always ask me how old the law firm is, and I always like point to my children. So always have had little kids. I never thought I would really get into advocating for kids, but they're tough cases, and it's just it's something I've been hyper focusing on as well. So not only in the practice of brain injury, but for kid cases as well. That carbon monoxide case, not only the mom, but she had the 3 kids.
How many kids do you have?
I have 2.
Do you feel like having your own kids made you better lawyer with dealing with kids?
I think 100%, because you can see, one, it just gives you empathy and a
Hmm.
desire that you have to understand this. You have to understand what was like. There's certain cases where it's just like, I feel like if it gets to like that watershed moment of like an Aaron Brockovich case or something like that. Like you just
Yep.
like you take it so personally, like you have to figure it out. You have to figure out a way. And I think I've taken on child cases like that because when I'm told by a lawyer, like, oh yeah, we dropped that case for this reason. There's no testing. There's nothing that can be done. Like there has to be something here. Um, I mean, it could be like the hyper specific fractures of scoliosis is just what you do. But what we found out is like there is no other brain injury law firm. People put on
Hmm.
a website they do brain injury, but there's no other law firm that this is all they do. And when you start getting all these cases from different realms of injuries, we're realizing the lack of resources, the and the lack of ability to like advocate for this, and the lack of knowledge from adjusters.
Yeah.
So I went on State Farm's website and I try to apply to be an adjuster. And there's a very little background that you need to do it.
Interesting.
So now I know who I'm talking to, like the barrier of entry of who I'm talking to as an adjuster. And so we just have to assume that the person I'm talking to that has all the power in the world to resolve a case for something that's just has zero baseline.
Well, I had an adjuster from State Farm tell me that this is based on her
Yeah.
training, that my opinion didn't matter because I got my degree by doing a few courses over the weekend. That's what she thought. And I was like,
I mean, there's this even, I mean, it's amazing. I go online and try to become an adjuster. It's very little barrier of entry. And their continuing education is next to nothing. And so when you know that the person you're talking to has zero background, zero, you're going to come in a different lens. You're going to say, my job is not to negotiate. My job is to educate.
Yep.
I'm just educating you, like, because whatever the policy limits is for a brain injury case, it's not enough. So I'm in a
Mhm.
different sphere.
And by the way, I
Yeah.
think people have misunderstanding that if I'm injured, I don't want to sue someone. I've never seen a patient that had injuries that wouldn't give up every penny they received to just never have had this happen.
Oh, of course.
All you're
Yeah.
trying to do is get their life to as close to normal as you can. And anyone that's been injured, there's no monetary value you can put to like replace when someone's life is permanently changed.
Oh, 100%. Just the pure inconvenience of it all. And like, especially brain injury, you're never the same. It's a permanent injury. And our brain is our source of everything, our identity, our soul, our information processing. Like, there's not a single person that would ever choose this. And so what we're just trying to seek is, of course, what's just, but where I feel like I'm at is I have to be able to set a standard of what these cases are valued at. The reason I have to do that is we have to get the general public to understand the serious nature of a brain injury.
Hmm.
Um, how to deal with it, how to prevent it, how to have more safety measures. I mean, it's great and all that, like, football now has like that safety cap additionally that's
It's
on,
always something advancing. Yeah.
but like we're so low level, and even with
Hmm.
CTE, it has to be post mortem to even like figure out after football players die, and we can like analyze their brain. We're seeing how catastrophic it was that they were living with, and it's still post morbid that we can, like, we don't even imaging when they're alive to be able to understand what they're going through. And so we really want to figure out, I mean, we're on the cusp, like a pinprick of understanding the full scope of a brain injury on a human.
Interesting. The reason I asked about the parent thing is in the scoliosis world, like I think once you have kids, you realize really if your kids are healthy and doing well, you really don't have a lot to complain about,
Yeah.
especially when you see, clients or patients that have, some really severe problems. That's one thing I'm like, I should never complain because my kids are healthy and doing good.
Yeah.
And I also think when I see some of the parents bring their kids in and they're just begging for someone to be able to find a solution. So I kind of feel like, all right, someday my kids may need help.
Yeah.
And I hope there's someone there with answers. So I'm going to pay it forward by trying to answer someone else. And similarly, like sometimes people come in and outside of surgery, there's nowhere else for me to send some of these patients to. So you just got to figure it out.
Yeah.
And so,
Yeah.
um, and I guess one thing as we're kind of wrapping up, some words of advice. You're out there, you have a trauma, you think I may have an injury in my brain. What should someone do? What are some definitely don't do this,
Yeah.
but like what just definitely do? What are some of the action steps to take?
The biggest thing I could tell you is it's like I don't understand how a high school could understand this. Like you get hit in the head with a volleyball. Well, you're out. You're not playing the next 2 weeks. But like as adults, like no one's giving this guidance. If you suspect you've sustained a brain injury, and again, it doesn't have to be impact. It can be that diffuse, that like very quick, rapid movement of the head, called coup contre coup. If you suspect it, and there is a period where you thought you felt dizzy, disoriented, maybe nauseous, and then like the next day was okay, you're not okay. So over the course of the next like 2 weeks, just really regulating yourself, limiting your driving, limiting work, limiting screen time. Over the course of the next 2 weeks, you may see the symptoms start ramping up. That's the biggest thing I can think of. I can't tell you how many people get in a wreck, think they're okay, and then go drive again and they get in another wreck because they are brain injured.
Then you get second concussion syndrome,
Yeah.
right? So
And
then
that's actually that's another pattern.
yep.
Many people get in double wrecks within the course of maybe a month because they are driving concussed.
Hmm.
And so really it's just if you suspect it, obviously I do recommend treatment, even though it's going to be someone that's going to prime you. It's
Hmm.
just good to document it. But if you are throwing up, that is the biggest sign. Go to the ER. If you're throwing up and you've sustained a brain injury, that's my biggest recommendation is that you go to the ER.
Yeah. Well, you mentioned the second they get wrecked a lot of times because they have a brain injury. But there's also when I did my training on athletes, they talked about if an athlete has a concussion and before that fully heals, they're participating. And I forget the exact numbers, but it was crazy. The likelihood of them tearing an ACL or a
Mhm.
hamstring goes up dramatic. And I remember right after I
Your
watched
balance is
your
completely off. They're gonna
reactions,
step and pivot completely different than they should.
I remember right after I did that
Yeah.
training, I'm watching this game, and this quarterback goes out for potential concussion, gets a concussion, comes back the next week, very first quarter, boom, blows his hamstring, and I was just like, oh.
Yeah.
But yeah, so that's what that reminds me of.
You're just not everything that you've taught, the way you stand, the embracing, like that's what we're talking about even with children, like regressing.
Yep.
Like whatever you're used to doing, you're not able to function. Like you're
Hmm.
not if you're an athlete and you're trained to the T about how you pivot or you do your stance, like you're not processing anything normal.
Absolutely.
So you're now basically like a child playing in an NFL game.
Yep.
Like you're not aware of what's going on. So for what we normally say is because of those things, it is statistically found that someone that has been concussed is 3 times more likely to get another brain injury, 8 times more likely to get the third. And each time it is quadruple the
And you see
symptoms.
that people where they just go boom, boom,
Yeah.
boom, boom. And I think when I was younger, I was the kind of person like fight through, get back out there. But now if I had kids knowing this, just like you just
Yeah.
gotta pull the plug because the long term potential implications on them.
Oh, 100%.
So if someone's watching this and they want to get a hold of you, how do they find you?
So you can go to our website. That's Nares, Nares, lawgroup.com. And we have tons of resources there, or call us at 720-637-7786. And what we do is we just give resources, whatever we can do, even if it's not a personal injury case, meaning you're injured at no fault of your
Hmm.
own. If it's my child sustained a concussion while playing football, right? It's not a case, but they need resources. Please, like, let us know through that concept of value beyond limits, getting all the resources in the world for our clients, like we have them. So just reach out if anybody needs guidance whatsoever.
Excellent. Well, thanks for being on the show. Appreciate your time.
Thank you. Bye.